Hi, this is David Kettlewell, and welcome to Medical Matters, because life matters. Perhaps one of our most important shows we've ever done, talking today about why every American should care that every American has access to reasonably priced health care. Interesting topic. Thanks for joining us. Thanks for joining us. And I want to first of all thank the Community Health Foundation of Western and Central New York that has made these shows possible. Our topic today, a very, very important one for all America, which is what is happening today with health care for Americans. And we're going to be talking today about in maybe some of the major cities what's happening, especially in New York here. And then also a little bit about, should every American care that everybody has access to health care? But let's go ahead and introduce our guests. We have, to begin with here, far right, Lavan Ansari, PhD. Doctor, thanks for joining us.
I'm glad to be here.
And we have L. Nathan Hare, and you're the Executive Director for Community Action Organization of Erie County.
That's right.
Welcome aboard.
Thank you.
And June Hayflick, you are President and CEO of the Sheehan Health Network. Thanks for joining us.
Thanks.
Question number one. Why should Americans care that everyone receive health care?
Well,
We're all going to jump in there.
Well, let me jump in from a financial
We'll go
perspective.
from- okay.
You know, me being the former banker here, I think overall for the nation, it will be less costly for the nation if everyone is in good health. You don't have people running to the emergency room or being in facilities where it is very costly. Better quality of life too.
What's wrong with everybody going to the emergency care? I mean, you know, they're in the hospitals are already there, they're funded by the public. What are the problems when a portion of the population attempts to utilize an emergency room for primary care?
Emergency care is very costly. The staffing of it, the infrastructure, just the facilities itself, the number of doctors that have to be there on call to take care of any type of medical care that comes up. But it's very costly. There's the wait for patients. It's just not an efficient way when you could go to a primary care, go to a clinic, and get the help you need quickly, efficiently, and thoroughly.
What do you see as the problems with people accessing primary care through emergency rooms?
Well, in terms of the problem of people accessing primary care, it's the cost of the care itself. The reimbursement rates that you get for primary care, if you're in a community that's primarily low income and poor, you're getting Medicaid, in our state, Medicaid reimbursement. Your Medicaid reimbursement rates for patient visits are so low, you just can't operate your clinics, based on that. So what happens is clinics just either don't serve Medicaid clients at all, or they limit the number of Medicaid clients they're able to serve at that clinic. So it drives the low-income populations, the ones that have the least access to health care, it drives them to hospitals, emergency rooms for primary care.
What you've just described, and I'll get back here in just a second, what you've just described is a situation that's occurring across America where in the inner cities, which is really kind of what we're talking about a lot of the time, it doesn't pay if you're a physician, and you can't live on the income if all you're getting is Medicaid reimbursement, which is about 10% approximately of what you'd get by managed care or Medicare.
Right.
So it's much, much lower. And so as a result, doctors do not accept a lot of Medicare patients or can't make their practice go on that, and that burden then falls heavily on the emergency room of the hospitals. Is this pattern not just in New York? Is this New York? Is it all over the country?
This is all over the country. And I don't want us to ignore the rural suburbs and the rural communities of our state. Now, people think that Erie County is a urban county because we have the city of Buffalo. The reality is that Erie County is also a rural county. In fact, dairy is the #1 industry in our county. And so, I mean, I need for people to understand that we have a huge problem of access, and I'm an agency that serves the entire county of Erie. Getting people access to the services that we provide at the Community Action Organization is very difficult when you get away from the first-ring suburbs in the city of Buffalo itself, because you just can't get enough economy of scale to operate services in these areas. That happens in medical care.
Could you put a personal face on the lack of access to primary care? How does that look to an average family that doesn't have a huge income? How does it impact them that they don't have that care?
I'll give you a very interesting story. We were out recruiting, because one of the things that we have to do when you're talking about healthcare in even urban centers is you have to go to them. We go to the community. And we had a senior who did not have dentures. She says, I'm using my dead sister's dentures because I can't afford $2,000 for my mouth to get fixed. So
Not
that's
the ideal hand-me-down.
no, absolutely.
Yeah.
I mean, those are the stories. Those are very real stories that we deal with every day.
How else does it look for a family that doesn't really have access to primary care? They're living in downtown Buffalo. I mean, how does it impact their daily life? And their life when the child maybe gets influenza or maybe has a cold or worse?
Well, you're talking a couple of things. You have Erie County alone has about 12,000 children that are uninsured. So that's our first issue, to make sure that those children get insured so they can get comprehensive medical services. But the other part to that, you're also training the child and the family to understand how to take care of their health at a very early age.
Well, you brought up a point a lot of Americans may not be aware of, which is the fact that if a family doesn't have a comprehensive insurance plan, that may mean that the kids can't receive care other than through certain clinics if they happen to exist, or school programs.
Right. So in our state, we have the Child Health Insurance Program, and there's a supplemental health insurance program. But again, your reimbursement rates from those services are very low. So it makes it difficult for you to be able to get care from a private physician who may know you and know your family. That's really what you want in healthcare, is to have somebody who actually knows you, that you're an actual case for them. You have a case history, you have a relationship with your provider. But if you're getting your care on an event basis, then you don't have that continuity of care. So one of the things that we have, having a community hospital like Sheehan or having a community health center like our FQHC at the community health center, provides you with a place where you can develop a relationship with a community of providers who become very familiar with you. But if you don't have access to that, then you're getting your care at the point when your health breaks down. So somebody's coming in sort of like you had a car accident. You know, we come in and we patch you up. We really don't know much about how you drove or what put you in a position where you had this accident in the first place. We're just cleaning up the stuff that we can see. And that's the way the health care is being provided for people that are in those situations. So then we end up with not even a two-tier system. It's like a 3 or 4-tier system. You have people who can buy whatever they need and have people following up with them all day, every day. You've got people who can pay for it when something comes up. They get a certain level of care. You got people who are in a health system that's a managed, healthcare system, and they'll tell you, here's what we'll go for, here's what we're not going to go for. So you get the person who needs crowns, to fill in for those teeth that are missing. You don't get those crowns filled in because it's not a medical necessity. Then you've got the people who basically don't get care until they're falling out on the street. It's that sort of thing.
Do you have any statistics on this, like
Well,
some kind of quantification of quality of care or amount of care that's received by somebody who lives in downtown Buffalo versus somewhere else?
Nate brings up a very important point. I think all of us, we have relationships with our primary care provider, and when you go in, they may see something else and say, I think you need to go to and take care of that before it becomes a problem. But
proactive care.
Proactive care. But in situations that we see in the inner city with the underserved and underrepresented population, they go in an emergency basis. They take care of the problem, and that's it. They may not be told that, your blood pressure is really up, or I think you have symptoms of asthma, why don't you go? And so,
or you're obese.
Or you're obese, and this is what you need to do, and through some managed care and consultation, and refer them to the right place. And so the chronic diseases, they grow, they're out of control, they're more costly, more expensive when it gets to that level. I think organizations like Dr. Ansari and Sheehan Hospital is that they will look at preventive care, chronic disease management and prevention. And we have physicians there that our clients will know that that's their primary care and look at the whole person.
What is Sheehan Health Network?
Sheehan Health Network, I can divide it in terms of two different types of businesses. We have the primary care, which includes subspecialty care, with cardiology, orthopedics, podiatry, but trying to take care of the whole patient. We have disease management for cardiology, for asthma, but we also have the other side, a different side, which is substance abuse, alcohol, and chemical dependency.
For more Medical Matters television shows, go online to medicalmatters.tv.